welcome to this presentation. As you see, we have a number of folks joining us today to talk about working with transgender and genderqueer students. And I see a number of folks in the room who actually could be up here doing this presentation as well. So feel free to jump in if you have your own comments, but also if you have questions as we go along. Our intention for this presentation today was to talk with you a little bit about resources available to trans students, particularly around healthcare issues and genderqueer students as well. And we want to talk with you a little bit about a brief introduction, and we want to give you a concrete skill to leave with today. And specifically, that skill is using gender pronouns, right? Seems basic, seems like the sort of thing you learned in grade school, really. But what we also forget is what we have learned our entire lives is our gender socialization, right? So because of that, we read people a certain way, and if somebody fits my box for a woman, she goes with that. And if this person tells me, well, that is not the pronoun that I associate myself with, right? It's actually really hard for me to backpedal in my own head and use a different pronoun, right? And we'll talk about that, and we'll get you to practice that, so that if you are working with a student, that it doesn't come out as, right? Which is often what it comes out as. And if it does, how do you recover from that, too, right? Because that will also happen. So we'll talk a little bit about terminology to make sure we're on the same page about terms here. Some of this is pretty basic, right? Stuff we learned, again, in grade school. So when we say sex, what do we mean by this, right? So this is Jessie's term, hardware, right? So what's in your pants? And specifically, we also use the term assigned at birth, right? When babies are born, we say, hey, congratulations, it's a boy or a girl, right? Those are the terms that we are used to using, right? And we forget that it's broader than just these two categories, right? That we have folks who are intersex. Some, it may be obvious at birth, and others, it may not be obvious at birth. It may show up later in life. We also have folks where a decision is made for them at birth, meaning they didn't have a chance to say anything about that. It was a choice that their parents made for them. And then as people grow up, right, they develop their own gender identity. This would be where we would think of the terms man or woman. And notice, on a lot of forms that we fill out, we say gender. What are the options that come after that? Male or female? But aren't male and female about sex? Really? Right, so we have in our society combined these two terms. Gender and sex in our heads are the same thing. What about those folks who that's not true for them? Right? And I would argue, personally, that those folks who do think of themselves as fitting where sex and gender match for them, and I would identify as one of those folks, that we also benefit from having an expanded understanding of sex and gender as different, right? That we all benefit from not thinking in terms of binaries and also not thinking in limited terms about sex and gender being the same thing. So who do you think you are, right? And notice that gender identity, we may think man, woman. What other gender identities might there be? This is where you get to speak up. So Colonie talks about the idea of spectrum, right? So if we think men, woman, there's quite a spectrum in between, and that folks can be anywhere along the spectrum, right? Other terms you may have heard. Genderqueer. Genderqueer, what does that mean? the term queer, right, would be one of those where traditionally in the Old English means odd, unusual, right? Those are the folks who might say, my gender is a little bit different from the more generic, I might use the term for that, right? You were going to say something. People who don't conform to the binary, and they could be anywhere along the spectrum, right? Gender fluid is another term, absolutely. Again, could be anywhere along the spectrum. And so that would be another term. Trans folks could fit anywhere on the spectrum, could identify on different parts of the spectrum at different parts of their lives, right? And so those are some of the words we want you to think about. Gender presentation, we use the word software. This is how do you present the outside? Your hair, your face, makeup if you use it, clothes, and body language. What does your body language look like, right? And that would be one of the things that you think about. That is how we read people often, is through their gender presentation. And that may or may not be connected with their gender identity. So something to think about. And sexual orientation, because often we have LGBTQIA all sort of lumped together, we forget that gender identity and sexual orientation are actually separate things, right? So what turns you on and who turns you on in particular, right, who you're attracted to is also separate. And you have people from all kinds of genders who have all kinds of orientations. So, we've already covered a lot of those terms. Transgender and trans is often a term we think of as an umbrella term. If you think of the term trans, right, when we say transcend, we think of somebody who is going beyond the boundaries, right? So transcending the gender boundaries is what we're thinking about. And if you think of that as an umbrella term, it really includes a lot of people. It may include transsexual folks. So MTF and FTM specifically means male to female and female to male. So those are folks who may have already transitioned or in the process of transitioning. Transvestite is not a term that I would advise using, but it's a helpful term right now for our use, would be folks who might change their gender presentation for a number of reasons. Some of it, and often the term drag king or drag queen are the ones you've heard about for performance or for a number of other reasons. Genderqueer, we've talked about that. Gender variant would be another term, right? And again, can be considered a bit of a large term, folks who don't fit within the boundaries of gender. Cisgender, how many people know what that means? Okay, some folks. Cisgender is this idea of you fit the gender that people read you as. So I am cisgender, right? Most people read me as a woman, and that is how I identify, and it fits, right? For me. And there's a lot of privilege that comes with that. I can walk in this world and have people read me the way I want to be read, treat me the way I want to be treated, most of the time. And right. And I don't have to think about daily issues like using a bathroom and being policed out of it, right? Whereas that's not the case for everybody. And intersex, we talked about earlier. In the interest of time, I'm being given it's time to go. I'm passing it on to Jesse.
Hi there, folks. My name is Jesse Zimbardo. I'm the community counselor, so that means I actually work for counseling services, but I also work in the lesbian, gay, bisexual, transgender, queer, intersex, and asexual resource center. So I do a lot of work with trans students. A quick note I want to say about all this terminology that we just went over, and Natasha referred to this in passing, but just so you all know, different people use all these terms different ways. So we're trying to give you kind of a working, functional starting place But with every one of these words, there are people who use it and embrace it and love it, and people who hate it. And you need to know that about every single one of these words. So for instance, she said transvestite is a little bit out of fashion. I know folks who still identify with that. Transsexual is a term that has come to be really unpleasant for a lot of people who are on that binary and who are going from assigned one way to living in what we would typically call the other gender, right? The other male to female or female to male. I still know people who use this word transsexual, and I know lots of people who find it really clinical and alienating. So just to know that about every one of these words. There are people who love them still, and so that's why we don't get rid of them, and people who hate them, right? So we go with what the student is using, right? So even if a student is using one of these words differently than Natasha and I are defining them, go with the student's language in terms of functionally working with them. Natasha referred at the very beginning to this idea of reading gender. And the reason I think it's really important to talk about reading gender is because all of our brains do it. My brain has been practicing for 37 years. When I walk down the street and I pass people, it categorizes them based on their gender. And if I try to take a walk down the street and turn it off, I won't be very good at it. My brain will want to do it anyway. And the reason I like to talk about this, so these are examples of folks who probably when you look at them, your brain probably gives you a category for some or most of them. And then if there's anybody up there who your brain can't easily categorize, your brain might get stuck looking at them trying to categorize it. That's just your brain categorizing. That's what your brain is supposed to be doing. That's not because you're evil or bad or insensitive or you don't care. That's your brain doing what it does. And the important take-home point here is for you to know that your brain might be lying to you sometimes. Right? That's all. So again, and the reason I talk about this is because this ties into pronouns and the fact that we tend to throw pronouns on people without checking with them. Again, that's something that we've all learned to do in our culture and that our brains want to do. And it doesn't make you a bad person for wanting to do it, but it's important to know that sometimes you're wrong and that you need to check and that there are ways to recover if you make a mistake, right? So that's our point in all of this. Some of these people, your brain is probably categorizing in a way that may or may not be consistent with what they were assigned at birth. Some of them not. It doesn't even really matter which is which. Most of these folks are celebrities, by the way, who have been open about their statuses around gender, just so you know that. But there are definitely people in here who you're reading one way, who their biology probably is not what most people would expect from what they're reading. Does that make sense? So again, really the permission here is it's okay that your brain does it, just know that sometimes it's wrong and have some strategies for that. The most obvious one is asking people what pronouns they prefer. So that is the very easiest strategy. And if you take one point out of this presentation today in terms of how you work with students, this pronoun piece is probably the one that students tell us would make the most difference to them in their day-to-day experiences of working with us as people, professionals who are providing them services, right? I have up here a very intimidating graph. The point of this is that you should memorize all of these by the time that you leave. That's not true. The point of this is to make the point that preferences can be incredibly individual. I don't expect you to memorize all of these. I certainly have not. And I have been working extensively with people of many genders for about 10 or 15 years. There are some of these that I'm really good at because I've had the chance to practice them, and some that I've never met anybody who used it. So for example, these are gender, you see he and she at the top, so those are the ones that most of us are used to, right? And then below that, you start to see gender-neutral choices, which are ones that do not give you a clue about the gender of the person who you're talking about when you use them. This is more and more important to students. More and more students are using gender-neutral pronouns. And gender-neutral pronouns tend to make people who haven't encountered them really anxious. And some of that anxiety is not particularly judgment about it, but is fear about doing it wrong. So again, that's where I want to come back to the idea that it's okay that your brain is trying to read gender, your brain wants to categorize things, it's just important to have the information, it's not always right, and to know how to ask. And we're actually going to make you practice that, just to make everybody a little bit anxious. And a few notes on these. It is the third one down. That's one that tweaks a lot of people. I've only known one or two people who preferred that as their own pronoun. But again, like that's their call for themselves. So it does make me uncomfortable to try and practice that, but it's more important to me to respect their self-identity than that I be comfortable with it, right? So that one doesn't come up a lot. They is the one that we're encountering most often, that most students are connecting with. And that can tweak grammar snobs to use they in the singular sense, but know that English is a language that does not have a gender-neutral pronoun in the first place, or has not historically. So I think claiming something that people are at least familiar with is practical in a lot of ways. And then co-Z, probably the most common one that I've met out of this chart, other than he, she, and they, is Z. This is one that some folks have even just started to use with the problem of how to write in a gender-neutral way when you're writing, when you don't have a gender of a person who you're referring to. Some folks have, that's where Z comes from originally, is the idea of instead of saying, he dropped his pencil, she dropped her pencil, Z dropped their pencil. And I'm gonna have you practice this. So just so you know, don't memorize them all, but there's just an example of how many there are. Thank you. Okay. I'm gonna make you introduce yourselves to each other. So this first exercise is really just about this idea of how practically do you ask somebody what their pronoun is. I've talked to a lot of people who say, like, Jez, I get it, I'm on board, I want to be sensitive, I want to work with students in a way that's congruent with themselves, but I don't know how to introduce it in a way that's not awkward. So here are my basic take-home points around asking for pronouns. One is, it might be a little bit awkward, and that's okay. So if you let go of the idea that there's a perfectly non-awkward way to do this, it can be a little less frightening at the idea of, yeah, it might be a tiny bit awkward, but the people for whom it's meaningful, it is so meaningful, right? And so what does that look like? And what I often coach is matter of fact is really good. This doesn't have to be like a huge, oh my goodness, we need to find somewhere private to sit down in a corner and I need to give you a 20-minute introduction about my credentials before I ask you your pronoun. Like, that's actually overkill in a lot of cases. I do try to be sensitive about not doing it in front of third parties, but it really is situational, right? So here's how I typically ask, and it depends some on setting, right? When I'm at the LGBTQIA Resource Center, where there is a lot of variety around orientation and gender, I am super casual about it, and it typically looks like this. Hey, by the way, what's your pronoun? That's it, nothing more complicated than that. And that typically goes over just fine in a setting where most people are familiar with the idea of preferred gender pronouns, right? In a setting that is not like that, where I might be talking to somebody who's never been asked a pronoun before, I don't know if they're even familiar with what I'm trying to ask, right? I might often say something more like, and here you go, referring back to it might be awkward. Hey, I don't mean to be awkward, but I'd rather ask than get it wrong. Can you tell me what pronouns you prefer? Uncomplicated, right? So there's not a correct way to do this. But if you look really freaked out when you do it, it's going to be harder than if you don't, for you and for them. And that's why we want to make you practice today, is just to have heard yourself do it. So what we want to ask you to do is find somebody near you, and this will be, you will get more out of it if you do this with somebody who you don't already know, just so you know. Introduce yourselves like you normally would on campus. What's your name? Where do you work? What do you do? Just an introduction, right? Your elevator speech, 20 seconds. And once you know each other's names, ask each other your pronouns. And this is not do it right or we're all gonna smack you on the wrist on the way out. This is hear yourself practice it. Hear yourself ask somebody their pronouns if you haven't done it before and see how it goes. So okay, we're gonna give you just a minute to pair off, introduce yourselves, and each of you ask the other what pronouns they prefer. And then we're going to come back together. So we'll give 2-3 minutes. Okay, we got a ton more to get through. I'm sorry to cut it off. Everybody's learning everything about everybody else's gender now. Okay, I'm going to start talking again, everybody. Sorry to cut you off. Thank you for indulging me on that. I talk to a lot of people who really say, I want to do this and I'm just nervous about it. So that's why we're really trying to push this idea of practice. The other thing I didn't quickly address, and this is a bit of a tricky topic, is when do you ask somebody's pronoun? But it's important to bring this up. You know, I work with a lot of activists who say you should always ask everybody's pronoun at all times, because like Natasha pointed out, even when we break down to sex and gender, there's two parts of gender, right? There's gender identity, what I would say I would say I identify as a woman. There's gender presentation, how you would read me looking at me. And it's that second part where our brains aren't quite as good as we like to wish that they were. But those two things don't have to line up. So what that means is somebody who stands in front of you and looks to you exactly like a woman, that's what your brain says, may prefer the pronoun he. Vice versa may be true. They may prefer any pronoun, but it's where it's opposite, it's where it's he for somebody you read as a woman or the other way around, that your brain will mess with you and make it hardest for you, right? So there are people who say, because there are so many folks like that, we should ask everybody all the time. I know some people are not going to adopt that standard. What I would also say, and what I typically promise is, or what I typically practice is, if I have any reason to have any question whatsoever, I ask. And if I get it wrong, I'm really open about just apologizing. And so that, another piece of this is, I don't think we can talk about pronouns without talking about slips or mistakes, because those are part of it too. And I know that wanting to avoid slips and mistakes are part of why sometimes people don't try at all, which is actually more hurtful to many folks who are trans than trying and making a slip or a mistake. So I'm going to give you a really handy-dandy way to recover when you slip or make a mistake. It's like this. You're going to have to memorize it. Hey, I'm sorry. And I don't even mean to be flippant. I mean, I'm always a little flippant, so that's me. But just really, it's just okay to say, like, heck, I'm sorry I slipped. I'll do better, right? And again, the more matter-of-fact and non-traumatized you are by that, and the more you can just own it, apologize, and move on, the less awkward and weird it's going to be in most cases. Does that make sense? Okay, we're going to do one more quick exercise. And this one, you know what I think I'm going to do? I'm just going to have us all read it out together. We're so short on time. And the reason I'm going to do this is I want to make you all say these words. They're not even dirty words, which is usually what I make audience members say. But I do want to read them together so that you can practice and hear yourself saying the words for these third ones, right? Z and they, and just to hear that, right? So will you all read along with me out loud? I know it's dorky, but do it anyway. Okay. She dropped her pencil. That probably sounds familiar. He dropped his pencil, right? Now here's the one that messes with people, right? You did it already. All right, let's do it again. They dropped their pencil. Notice they dropped one pencil. We're not talking about two people here. We're talking about one person with one pencil. Here we're going to pronounce it Z-I-Z and Z-I-R-Z. Z dropped their pencil. For people who haven't encountered this before, this is where it starts to sound weird. Just get your ears used to it. It just sounds weird because it's unfamiliar, not because it's wrong or bad. And then a couple of more, just to practice some more. She outed herself to me. Probably sounds familiar. He outed himself to me. Okay, cool. Here's where it gets a little harder. This themselves messes people up, okay? They outed themselves to me. I don't know if this should be themselves or themself. Themself really messes with my brain, but maybe that's the way it should be. And then, Z outed zerself to me. You've heard yourself use gender-neutral pronouns now. Thank you. And now I'm going to turn it over to Dr. Michelle Famula, who does our medical care on campus, to talk a little bit about transitioning.
Thank you. We're going to go to the next slide here. And I'm going to try really hard not to kill myself over this. Hi, my name is Michelle Famula. I'm an Executive Director of Health and Counseling Services on campus. And I wanted to talk a little bit about the kinds of services that we provide to students who are in transition or who have transition that supports them medically. And I just want to say this is not really a medical lecture. This is just trying to make sure that people know what services are available here on the campus. And I'm going to start a little bit by talking about our insurance benefits, and then I'll talk about exactly what we offer in our clinical services on campus. So actually, since 2009, the Davis campus has offered, through their student insurance plan, coverage for trans care benefits. And you know, depending on all of the language, really, when we talk in medicine about transsexuals, we're talking about individuals who do, in fact, want to change their bodies in order to be more congruent with their self-identities. And without getting into that in a big way, it really matters if you have insurance coverage that will pay for hormone therapies or surgical therapies. These are not readily affordable. If you think about it, hormone therapy for any medical condition or surgery for any medical condition, particularly genital condition, is not an inexpensive operation. And so it really matters if you have healthcare financing for those things. It actually came to our plan at the request of students. It was students who asked that we get a quote on what it would be to add that benefit. And then when we got that quote, It was students who voted to add it to the plan. We've had it in the plan since 2009. So currently now, just so people are aware, Davis SHIP enrollment is limited to registered students, but all registered students are eligible, and the plan itself is ACA compliant, Obamacare, Affordable Care Act compliant. And because of the ACA compliance, this has meant a lot for our transgender students as well, because prevention services are available without copay or deductible as part of the plan. This is true for all students who are on it, but this really means that our trans students have access to the kinds of preventative services that generally will include screening, wellness exams, immunizations, those kinds of things that sometimes have been difficult for them to get. And there are no pre-existing limitations, and it has no lifetime max. So I can tell you back in 2009, there was a $75,000 cap on transgender benefits, but there's no cap on benefits now. And so ongoing care, surgical care, is really covered full. And there's no pre-existing limitations. So it used to be that even though we had benefits at a time when there were pre-existings, if someone had transitioned before coming to campus, they might not have qualified for services. That's not the case on the current plan. Our plan is an Aetna plan, and why that matters is because the best benefits, like any other plan, are going to be if you have an in-network provider. And that's true for our students, too, in terms of surgical care. There are in-network providers for surgical care. There are in-network providers for mental health therapy as well. And so we can make that available to students as an adjunct to the services we have on campus. Basically, it's important to recognize that on the plan that students are eligible for on campus, transgender benefits are covered like any other chronic medical need, if you want to say, or chronic medical condition. And for some people, it is offensive to refer to it as a condition, implying that there's a disease process going on here. But in terms of chronic care, all the benefits are available just like any other chronic management. The two most common medical interventions, I would say, that are required by our patients are hormone therapy. And again, with regard to the SHIP, and I just use this as an example of our plan, students come to our campus and waive SHIP with 600 different insurance plans. So they really need to know their plan, and to the extent possible, our insurance office will sometimes help them with that. But I do know our plan really well for those students who are on SHIP. So hormone therapy requires no pre-authorization. It's considered primary care. And so if a primary care provider is ordering that therapy, and I'll talk a little about what the guidelines are for doing that, it's not like we need fancy permission from the insurance company. It can be ordered by the primary care provider. It can be filled on-site or through a community pharmacy. Pharmacy benefit on this plan, it's $5 for generic, $25 for brand, and $40 for what's called non-formulary. There isn't a deductible on the plan. There isn't a pharmacy maximum. And that's important. Some of these prescriptions are expensive. Some of them are ridiculously cheap. I mean, they're generics. They're like, you know, the Target stuff that 3 months for $10. So I have a lot of patients who, well, not a lot, but I mean, I've had patients who've come in and bought their medications off the internet thinking that it's going to be incredibly expensive. If they use a regular pharmacy, it's actually much less expensive through a regular pharmacy or Target and Walmart than it is online. And often online they can't get the right medications. So we've done some transitions around that. With regard to surgery, that does require pre-authorization. There are actually a lot of surgeries that do require pre-authorization, and this is one. And what the Aetna plan does is that it follows what are called the WPATH standards, the standards of care for surgical authorization. So a couple of things to be aware of is that, again, we try to use the in-network providers to make sure that there's the best benefit for a student if they're having surgery. And I have had students who have had surgery while they're enrolled here on campus. Chest surgery or top surgery for transitioning males is actually a fairly uncomplicated surgical procedure. It can often be done during a quarter break without any disruption of school. Genital surgery, pretty complicated surgery, and most of the patients that I've had have done that over the summertime, but have been right back in school next fall without a problem. Again, we follow the WPATH timelines and criteria. We do have a requirement within the plan, and these are the WPATH standards, that we have the treating mental health provider who is assessing the individual that they actually have what we refer to as a dysphoria, that they will be improved physically, mentally, psychologically by having treatment that enables them to consolidate their gender identity. And that requires just that one letter from the treating therapist who's familiar with them. And that's for non-genital surgery. And there isn't any hormone requirement. There used to be a hormone requirement. So for those of you who are familiar with this, who may have read some of the old guidelines, there was a hormone requirement for any kind of surgery. There is no longer a requirement for chest surgery. And if you think about it, it's probably not a bad idea, because if you're going to start hormone therapy and you're going to get changes in body hair, you're going to get changes in sweat, oil gland production, if you need to have chest surgery, you want to have chest surgery before you're really complicated by all of those hormonal effects. As far as genital surgery is concerned, it's kind of interesting how they require this. The treating clinician in mental health provides the letter for what's called eligible. They will benefit from this, and readiness. And then a second mental health therapist basically confirms the assessment of the first. They don't have to see the individual, but they basically are assessing in a peer way that this seems to be appropriate. And that's really the whole requirement for genital surgery. They do require that there's been 12 months of hormone use as part of the preamble to the surgery. And again, many of our students who've identified on campus qualify for the hormone and the sexual and the surgical transition during the time that they're here, and it doesn't really disrupt their ability to participate academically. And so that's some of the conversation that I have with my patients about whether or not that's something that they would be able to achieve and also maintain their student status. A couple of things here, probably won't get through all my slides, but it's really important, I think, to understand why would we offer these services on campus. Is this excessive? No, this really isn't excessive. This is primary care. So in the college health setting, we really do have a population that we really understand that the psychosocial issues of what are going on in their lives really impact their success, and we want their college experience to be as successful as possible for them going forward. Typically, this is a primary care staff who's very familiar with sexual health, anatomy issues, sexual identity, gender health, and should be in a position to speak to these issues probably a lot more comfortably than many of their pediatricians did or internists in the community. And hormone therapy is really primary care. It's not that special. I have consultants who help support me when complications are potentials, but the care itself, not really complex. And we do have the resources, and training is definitely available now. Why do our transgender students need on-campus health care? Well, I think I would really argue that holistic care is more than just hormones and surgeries. It's really about paying attention to their overall health needs, their wellness needs. In general, I mean, if you're going to start hormones, for example, and you're a cigarette smoker, I mean, you really want somebody that's going to be paying attention to that and paying attention to what it means to a student to try and give up tobacco. These kinds of things all play into one another, and integrated care is very important. Unaddressed gender dysphoria, I mean, I could just read it off the slide. It's a barrier to academic and social success, and it's clearly a barrier to emotional well-being. Many of our students who come seeking care clearly articulate that where their gender issues have been unaddressed have really had a negative impact on their lives. And providing this care on our campuses, I think, really underscores our commitment to diversity, inclusiveness, and social justice for this group on campus. And I think, as Jesse alluded to, there's probably a whole lot more folks on campus that you've worked with, whether you know it or not, who really are our trans population. So the typical patient narrative, just to go through this real quick, they recognize their identity, and we get them connected to folks who can help them from the therapy perspective, not because they're crazy, But because there's a lot of emotional well-being that gets tied into addressing this, helping other people in your world to recognize what you're recognizing as a trans individual, and seeking the resources that you need. They get to a physician who is familiar with care, hormone therapy, and within a year, if it's appropriate for them, can get directed to surgical therapy if necessary. And many of our students who come in have had a dream of that since they were 14 or 15 years old, and in some cases couldn't even imagine that they'd get into a setting where that would really be possible for them. So transitioning at UCD, we have, as you're meeting them, many of the mental health professionals here on campus. We have medical services. We have access to finance for them. They can enter through either side of the house, whether it's through our counseling services or our medical services. We follow standards, and there are standards of care. When I started doing this care in 2003, I was scarfing around everywhere, and all I could find was information from Canada. There's now a Center for Transgender Health Excellence at UCSF. The American Board of Endocrinology now offers guidelines and standards. This is really standard of care, and it's conventional medicine at this point. Okay, so that's my part of it, and I'm going to turn it over to Wynn.
Thank you. I'm going to try to just power through this because I want to make sure we get to the slide about how to support our trans students here. So these are some of the big issues that trans folks deal with, coming out issues. I'm thinking specifically with families. For some, I worked as a community provider longer term with some of our students, and it's one thing to come out to your family as possibly being gay, bisexual, or lesbian. It takes it to a whole other level when you're coming out to them that you are no longer their son or their daughter, and the loss that entails for the family. And so that we can work months on just getting to the point where, how do you talk about this with your family? And then just the overall stress of when you begin to decide to present in the other gender. So say if you're transitioning male to female, how do you even acquire the things that you're going to wear? Going shoe shopping, you know, and do you have large feet, or do you have, I mean, it's just like these little details that are very stressful when you put it all together. And I think we take it for granted, those of us who are cisgender, the privilege that we hold in just being able to go buy something that we like without worrying if people are looking at me or, you know, judging me. And then I think restrooms are a huge issue. This may seem really obvious, but how would it feel if you didn't feel comfortable going to the bathroom all day long, you know, from the time you left home to the time you got home at night, because there was nowhere comfortable for you to use? And just the importance of gender-neutral bathrooms on campus and just how meaningful that is for people. And a gender-neutral bathroom is a bathroom that is separate and private so that you're not sharing stalls or sharing a public space with people. And so there is a map, the LGBTQ, oh God, IARC has that listed on their website if you ever want to know where those bathrooms are on campus. And then just relationship issues when you find yourself interested in someone or moving towards that, and when do you disclose? What if they don't know? Is it totally shocking to them? And then issues of transphobia, some of the things we've already talked about. The intersections of identity, that there are just intersections of identity in other ways, whether what does it mean to be trans and be Filipina? What does it mean to be trans and come from an evangelical family? These are all issues that intersect and make it sometimes more complicated or just difficult to get through. And then again, transitioning, just the amount of time and commitment that it takes to transition. And transition, I guess I wanted to start out by saying, the experience is different for everyone. so there is no one stereotype or one path, and so someone may decide they only want to get top surgery and never get bottom surgery, or someone may decide they just want hormone therapy and nothing else. That there's that continuum of what is right for each individual person, and so to not make assumptions about that. But again, that's why I really advocate for getting some therapy as you go through this, because there's just so many specific things that need to be worked through. Although I say that, and for some people it's totally easy and it's not complicated at all. So again, just the uniqueness of each person. And then just issues of overall wellness. So I want to, is it the arrow? Okay. So most importantly, I think for the people in this room is how do we make our campus more friendly and welcoming to people. So the first one is that if all UCD paperwork could provide more than 2 options, and I'm not sure because we were talking about how Banner populates things. Do you want to say specifically what the options are? Do you know, outside of male, female, but that would be a goal to incorporate these other options into that. The gender neutral bathrooms, provisions for preferred name or pronoun. I know that I facilitate a support group through counseling services, and the way we begin is, what's your name, what's your preferred gender pronoun, and just having people write that out on a card, just getting into that habit. The education of staff and students. There are, I know in October, coming up trainings that are 2 and 3 hour trainings that will be more in depth than this presentation today for ways that you can be an ally and supportive. And then Dr. Pamela already addressed the appropriate medical care that is wonderfully available through our campus. We have a gender group that, does it have a regular day and time available? Or
Gender group meets twice a week on Wednesdays and Thursdays. It is a closed group, so that means only students who identify as somewhere under the trans umbrella, but that includes questioning students, so it doesn't have to be somebody who has an answer to the question yet. And so we connect students to that through the facilitator, since it's a closed group, so that they can get connected into it.
And finally, the visibility of resources, so that the more people we have aware of the resources on campus, the more it's easier for us to offer it to our students. And so I know when you complete the Safe Zone training, you get a card that says Safe Zone, and you can put it in your office, and people will know that you're an ally and that you're someone that they can approach to talk about these things. So that's the end of my slide.
So we have just a moment. I know that I think we're about 10 minutes behind overall, so maybe we have to, whoa, I'm going down now. That is there just for that purpose, I swear to God. So we have 2 or 3 moments. Anybody have questions for Michelle or me or anybody from the CTTC? Right. Than more than 2 options. That's a really long conversation. There's no excellent answer to it that everybody likes, but we're really happy to have the conversation with you in depth about your needs. People have talked to me about that. Kote, who's the director of the LGBTQIA Resource Center, I've seen her having that conversation with people. So we're happy to work with you directly on any forms you have and give what support we can. A lot of times it depends on what you're trying to accomplish in the paperwork, what the best options are. I'm sorry, there's no easy answer of here's the 5 things we should put. I wish, you know. Yeah, please.
Yeah, so I think always if you can, and I know a lot of folks who are doing surveys can, if you can, putting gender in a blank line, if you're
That's the ideal.
providing a lot of that, that's always the first.
Yeah.
And then if you need more finite list, I've got ready to go email that outlines kind of your order of preference, what to ask of surveys. So I'm happy to send that to you.
Awesome. E has a better answer to me. To repeat the first part for anybody who didn't hear it, the ideal is gender blank lines, so people can put in whatever word they want to put in. That is the absolute ideal if there's a way to do it. Absolutely, in every case. So, yeah. Mm-hmm. Do you mean to be asking about here or in general? Yeah. So Katie's asking about just sort of attempts to educate people developmentally earlier in the timeline. So there are efforts like that happening, and it's incredibly geographical. You know, I come from Hughesville, Pennsylvania, where nobody knows that there are transgender people, and like they're not talking about it in the schools, absolutely not. But here in the Bay Area, there's an organization, I can't even think of the name off the top of my head, but I can look it back up, that specializes in coming into schools and doing consultation on how they can be more gender spectrum, on how they can be more gender inclusive. Right, so that's an organization that specializes in it, and a lot of other orgs address it. So like it's changing rapidly now. And more, the high schools, the middle schools in Davis have just started inviting us in to come talk to them about this stuff. So it's starting to shift in Davis right now. Yeah? An organization in Sacramento? Okay, great. Similar to Gender Spectrum. Okay, great. One last question, anybody? Yeah, Andrea?
Okay, yes. So the question is, in order for us to provide medical care on campus, do the mental health professionals who refer the students have to be here on campus? No, they don't. And in fact, one thing I think might be worth sharing and sharing among your colleagues is that if you are aware of a student who wants to know more about the services, one handy-dandy thing about being a director is I have a lot of administrative hours. And I've met with students administratively. I guess I can sort of, or through Jesse, you can get my contact information, but it's on our website. But I've had students make appointments to just come talk to me about what kind of services are here. I'm happy to talk with them. In many cases, our students are not on CHIP. They have healthcare providers in the community. The community mental health professionals are aware that we provide medical care at the health center, and if they know they have a student, they'll refer them to me to talk to them about our services here. So no, we interconnect with community providers all the time.
And on that note, on this first slide, we had something up here called the Consultation Team for Transgender Care, and I just wanted to point that out. What this is a group of the mental health professionals, both through counseling services on campus and some of our community providers. The ones I've listed here are the ones from our own counseling center on campus. This is me. But can I ask the other folks on that consultation team to stand up and be identified? Natasha and Hwin, who both spoke, were also on it, and Tatum in the back. Just so you know, we get together every month to coordinate care. So what we're trying to do is make this smooth for students, and we interface directly with Michelle and with Chuck, who's our insurance guy, to try to keep things going really smoothly and the lines of communication open. So just so you know, there's a special group on campus that meets around trying to keep all of this running smoothly as best we can.
One final comment is insurance is still insurance. You know, they don't make it easy. So one of the things that we've been really, really fortunate about is Chuck Octorloni, who couldn't join us today, and then also our case manager from Aetna, really work closely with us to get through the bureaucracy of insurance. But I can't tell you that just because we have this service, it's easier than anything else you try to authorize in insurance, but they work really closely with us to try and smooth out the bureaucratic speed bumps for students.
Thank you all.